Hello. Today, I would like to discuss a normal anatomical structure of the pyramidal lobe region that was misinterpreted as a lymph node. At an outside clinic, an 8 mm thyroid nodule underwent fine needle aspiration FNA and was diagnosed as papillary thyroid carcinoma. In addition, a hypoechoic lesion in the pyramidal lobe was also biopsied and interpreted as a lymph node. On the ultrasound images from the outside clinic, the lesion diagnosed as papillary carcinoma is shown. The images below were interpreted by the outside clinic as a lesion in the pyramidal lobe. The left image is a transverse view, and the right image is a longitudinal view. This is the cytology report from the outside clinic. No malignant cells were identified. Instead, lymphoid cells were observed, and the differential diagnosis included lymph node versus thyroiditis. I performed a preoperative staging ultrasound and identified similar hypoechoic lesions not only on the left but also on the right side. I interpreted these findings as hypoechoic areas within the thyroid cartilage, consistent with endochondral ossification. After sharing the ultrasound findings with the pathology department, we performed a slide re-review at our institution. As shown, the pathology report described cartilaginous material with inflammatory cells. Endochondral ossification of the thyroid cartilage typically begins between 15 and 20 years of age and is completed in the 50s to 60s. It is more common in men than in women. Ossification of the thyroid cartilage progresses in a characteristic sequence, as illustrated in the diagram. On ultrasound, endochondral ossification of the thyroid cartilage may appear hypoechoic internally, or it may appear hyperechoic, as shown here. It may show expansile features, but not always. If one is not familiar with normal ultrasound anatomy, this finding can be confused with lymph node metastasis, as described in the literature. However, with knowledge of the normal ultrasound appearance of the thyroid cartilage and consideration of the patient's age, the diagnosis is usually straightforward. Finally, I would like to show a video obtained during a neck ultrasound in a 29-year-old man, in which multiple hypoechoic ossification foci were observed within the thyroid cartilage. Thank you very much.